Hello and welcome to the UNITE Global Summit Day 2. Today's focus is Science and Innovation, Hope for an Equitable Future, and we've got 4 brilliant sessions for you today. I'm Eloise Todd, a proud partner of UNITE with the Pandemic Action Network, and we've got a host of partners and politicians from across the world today for brilliant discussions. The discussions today range from our first on antimicrobial resistance to the political will to end neglected tropical diseases, the Global Drug Policy Index, and finishing the day with digital transformation of health. It gives me great pleasure to kick us off and hand us over to Claire Doole, who's moderating our first session on antimicrobial resistance. Claire, over to you. Looking forward to the session.
Thank you very much, Eloise. And this session's organised by GARDP. That's the Global Antimicrobial Research and Development Programme. And over the next hour and a half, we're really going to be focusing on what needs to be done to speed up the response to antimicrobial resistance, often known as the silent pandemic. Last June, G7 ministers of health and finance committed to confronting this growing threat with meaningful and concrete actions. So with the UK handing over the G7 presidency to Germany next month, our discussion really is a strong call for action as we move into 2022. And Japan will hold the presidency in 2023. So it's really my pleasure to welcome speakers, first of all, from those 3 countries. Dr. Hajime Inoue is Japan's Assistant Minister for Global Health and Welfare at the Ministry of Health, Labour and Welfare. Dr. Inoue previously worked for WHO as a senior advisor to the Director General and has been the special representative for antimicrobial resistance. Dr. Andrew Ullmann is a member of the German Parliament, a physician by training. He is Professor of Infectious Diseases at the Julius-Maximilians Universität Würzburg and is a leading advocate at local and national level in eliminating infectious diseases. Dr. Lisa Cameron is a Member of Parliament for East Kilbride, representing the Scottish National Party. Dr. Cameron is chair of the All-Party Health Group in the House of Commons and is a member of the UNITE Global Parliamentarians Network. And we're also joined by Dr. Renu Swarup, former Secretary to the Government of India, Department of Biotechnology, Ministry of Science and Technology. Dr. Swarup is a Fellow of the National Academy of Science and a member of the Organisation for Women in Science for the Developing World. And last, but certainly not least, Professor Laura Piddock, Scientific Director at GARDP. For more than 30 years, Laura has been at the forefront of antimicrobial research. She teaches at the University of Birmingham in the UK and led the Secretariat of the UK All-Party Parliamentary Group on antibiotics for many years. So as you can see, we have a really impressive lineup of policymakers, politicians, scientists, doctors, and academics. They're going to be shedding light on national and global trends, discussing the lessons learned from COVID, highlighting the importance of strengthening global collaboration, and of course, stressing the key role that MPs must play in developing and accessing new antibiotics. We will be taking audience questions, so please do submit yours in the Q&A function. And if you would like someone specifically to answer your question, please tell us who. And one other thing, of course, tweet using hashtag Unite Global Summit 2021. But before we hear from our speakers, here is a short video to set the scene. It's now my pleasure to ask Professor Laura Piddock, Scientific Director at GARDP, to give her keynote presentation on the silent pandemic of antibiotic resistance.
Thank you, Claire. So I'm Laura Piddock, and I'm Scientific Director at the Global Antibiotic Research and Development Partnership. And I'm delighted to be able to present this short outline of antibiotic resistance and what we can do about it in the next few minutes. So the discovery of antibiotics has changed all our lives. Without them, many of us would not have survived from childhood to adulthood. And I think we forget the critical value they play in our daily lives. So in just under a century, millions, literally hundreds of millions of lives have been saved. They underpin all areas of medicine, not just a chest infection that many of us have suffered in the past, but the high-tech medicines such as transplant surgery, knee replacements, hip replacements, wound infections, cancer patients, all areas of medicine. And for one drug alone, penicillin, it's estimated that this has saved between 80 to 200 million lives. So for all the antibiotics, there's over 100 available throughout the world. These are hundreds, thousands of millions of lives that have been saved. And we undervalue these drugs. Unfortunately, there's quite a lot of drug resistance about. So we need to keep on making new treatments and using a variety of drugs to treat drug-resistant infections. This is one way we can measure drug resistance. And this is a measure very similar to some of you may have seen for measuring consumer prices or stock market values. And this is a composite measure that combines the ability of antibiotics to treat infections, their extent of use in clinical practice, and resistance. And for some countries, as you can see here, there are very high resistance levels, whereas for others there are low. One of the issues, of course, is that in high-income countries, there are numerous options for antibiotics, but in lower-income countries and middle-income countries, there are fewer choices. It doesn't matter where you use antibiotics, whether it's in a person, an animal, or in the environment, any exposure allows bacteria to evolve and become resistant to them. So the more we use antibiotics, the more likely to select drug-resistant bacteria and allow those to be transmitted throughout the world. As in any infection, whether it's drug-resistant or otherwise, it's the most vulnerable who are hit hardest. And we know that at least a third of the estimated 700,000 annual deaths from drug-resistant infections occur in newborn babies. I just want to be clear that that figure is an estimate. It's not like COVID, where many countries monitor the number of daily cases of people with that infection, which is a single virus, the number of people going into hospital, and the number of deaths. Drug-resistant infections are caused by many different bacterial species, and there's many different drugs or antibiotics. So it is estimated that this value is very much lower than we're seeing in reality, particularly for some countries. And we know where there's the highest number of infections and the greatest number of vulnerable people, that there is the greatest need and where new drugs could have the greatest impact. But it may surprise you to know that whilst many antibiotics are developed over time for adults, very few of them end up being approved for children and babies. And this is a neglected area of drug development. So just imagine if COVID-19 had initially targeted the young versus the elderly. How different would the world's response have been? Would we have allowed a generation to be wiped out? Because that's what we're allowing with drug-resistant infections. So the silent pandemic of drug-resistant infections is here and getting worse. And what do I mean by silent pandemic? Well, for many in high-income countries, we also have drug-resistant infections, but we have the luxury of having alternative options to treat, whereas some parts of the world don't. So what can we learn? Well, the pandemic of infections has great commonality between drug resistance and COVID, so they can affect anyone of any age, anywhere. They spread quickly and around the world. We know that prescriptions of antibiotics increase substantially during any viral pandemic, including with COVID-19. And these drugs are not only used for everyday medicine to save lives, they're integral to the response to future viral pandemics. So the lessons we've learned from COVID, investing early, the amount of investment and global collaboration has been truly outstanding. And this is why we've had new vaccines so quickly and new treatments so quickly. And that collaboration and international coordination has been critical. For antibiotics, traditional market incentives are not sufficient. And we saw that too with the AstraZeneca vaccine. That was not a traditional market incentive. And it was only once the pandemic is over, they will then start to sell as a profit-making entity. We know that a global response requires equitable and affordable access. And unfortunately, this is one issue that we still have with COVID-19, because inequitable access to medical countermeasures, including vaccines and drugs, can undermine trust in the international system. And as the Director General of the World Health Organization has said, for all the challenges that COVID-19 has caused, it has also shown the way forward for other challenges that threaten humanity. And this includes drug resistance. So in response to the crisis of drug-resistant infections in 2019, GARDP set a goal: 5 new treatments to address antibiotic-resistant infections by 2025. So the problem we face is increasing drug resistance, gaps in access to new and old drugs. There's a precarious R&D pipeline to develop new drugs, particularly in clinical development where funding can be lacking. There is a market failure because antibiotics are sold cheap, and therefore there's inadequate financing because this is not seen as a profitable area. So how GARDP helps is we focus on a public health orientated portfolio through partnerships between industry and the public sector. We invest in and co-develop clinical and pharmaceutical development, helping to offset costs and minimize risk. We can leverage public and private funding and develop sustainable access strategies and promote sustainable reimbursement models. We are focusing our 5 new treatments on the areas here: serious bacterial infections, such as hospital-acquired pneumonia and sepsis, bloodstream infections in adults, but also in newborn babies, neonates. We're also focusing on pediatric development, getting those much needed antibiotics into children. And we also have a program on gonorrhea, and we are leading on a phase 3 clinical trial now that's in 4 countries, and we've already recruited just under 200 patients. That's despite the COVID pandemic. And you could view our activities a bit like a train with lots and lots of different carriages, from patients to civil society to governments to all of those people involved in developing a drug, from hospitals to universities to industry. So we have some recommendations for governments learning from those lessons of COVID. We need to urgently address the pandemic of drug-resistant infections, whether silent in some countries or glaringly obvious in others. We have to invest in the development of the appropriate medical countermeasures and ensure access to everything that is available. We have to expand global cooperation, and in doing so, we need to make sure that low and middle income countries are equal partners in a comprehensive response. The G20 and G7 leadership has already made AMR, antimicrobial resistance, otherwise known as drug resistance, a G20 priority, first under the German 2017 presidency, and this has continued to this day. Indeed, in June of this year, the G7 Ministers of Health and Finance committed their nations to confronting the growing threat of antimicrobial resistance with international and cross-sectoral collaboration, appropriate provisions for responsible use of antibiotics, diversity and security of supply chains, and expanded global access and environmental protection so that when these drugs are made, they're not overspilling into our rivers and waterways. So responsible manufacturing and disposal. And we were delighted that at this G7 Health Ministers meeting, the work of various initiatives, including GARDP, was recognised. So as parliamentarians, you can help turn these plans into action and make the case for increased investment in antibiotic research and development. I leave you with this thought. Will we wait until there's a Greta for antimicrobial resistance? Or are we going to take the concrete steps now to address this pandemic so that our younger generation do not have to face a post-antibiotic era? Thank you very much.
Thank you very much, Professor Piddock. And as you said, there's a lot of drug resistance about, there's a lot that needs to be done, and we're going to find that public-private partnerships, global collaboration is going to be very, very important going forward. The UK, as I mentioned, is about to hand over the G7 presidency to Germany. Dr. Lisa Cameron is now going to talk to us about the UK's efforts to address antimicrobial resistance. Dr. Cameron, the floor is yours.
Thank you so much, Claire, and thank you to Laura for an excellent presentation. It's a pleasure to be with you this morning and to represent UNITE as well. My involvement in terms of antimicrobial resistance has been both as chair of the Health Cross-Party Group in the Parliament and also previously as a member of the Health Select Committee. In 2018, the Health Select Committee undertook an inquiry report into this issue, and at that point we highlighted to government that this posed a grave threat to health. It must be addressed, or modern medicine could be lost. And the report evidenced figures that suggested that by 2050, antimicrobial resistance could kill 10 million people per year if it's not tackled, which is more than cancer and diabetes combined. So we definitely cannot underestimate the scale of this matter and how serious this is. It could also make previously life-threatening illnesses such as TB, pneumonia, or malaria, which are treatable, less treatable. Currently, antibiotics also enable safe surgery, protect cancer patients during treatment, and as we've seen, protect some of the most vulnerable people across populations around the world. But the risk of death from these infectious diseases becomes much higher with the rise of resistant infections. And what we were hoping to do, and the recommendations that we put forward to government at the time, was firstly to raise the profile of AMR at home and also internationally. As has been said in the presentation, which was very eloquent, this is almost a silent issue in that we don't have enough awareness internationally and also at home here in the UK. We asked government to make it, in fact, a top 5 policy priority with a dedicated budget to enable work in the area. Because we knew that no new classes of antibiotics have actually been discovered for many, many years. And that was partly during the inquiry linked with pharmaceutical profitability and a lack of investment in development. So it's been excellent this morning to hear that many steps are being taken to address those matters in particular, and the investment in scientific research will be absolutely crucial. One of the other issues that we really need to address in this realm is a protection from overuse of antibiotics within our own populations, the reduction of unnecessary prescribing, and public engagement campaigns and best practice across general practice in order to ensure that there's consistency in both that message and also the application, to make sure that antimicrobial resistance is tackled, because we found there was such a variation in uptake of best practice right across the UK, that this was something that was very patchy and certainly not something that had been rolled out consistently. So we asked for coordination across organisations, across our health service and beyond, and a clear message on the value of vaccination and the uptake of vaccination too, because I think we can see from the pandemic just how vital that clear message is, but also in relation to antimicrobial resistance, it's going to have a major impact. One of the other issues that was addressed in the report that hasn't quite been mentioned as yet this morning is antibiotics use in farming, which we find to be an important contributor, and we had suggested that that must be kept under review, and that there should be clear guidance in relation to that particular issue. I think we can see, given the struggles that the world has had over the past 18 months with the pandemic, just how vital it is to have early prevention and intervention on these matters. How important it is to make sure that there's a coordinated approach, not just at home, but internationally, and how important it is that we make these matters, the health of our nations, more visible. We engage the public and we make sure that we work collaboratively together from the bottom up, as well as across political leaders. And we asked for a government department to coordinate this work. And that's certainly something that the health group in Parliament will continue to push with government here in the UK, and to push for that coordinated response that Laura had emphasised is so vital. So I thank you for having me here with you this morning to speak about these matters. Our last report was 2018. We've since had the pandemic, but I think it is important that we have a follow-up report to see where we're at in the UK, how we can more effectively collaborate and coordinate our response internationally in order, as has been said this morning, to protect the most vulnerable, but also to ensure that the early prevention and the lessons learned from the pandemic can be taken forward to protect future generations. Thank you.
Well, thank you, Dr. Cameron, and also for pushing the issue of antimicrobial resistance high up the policy agenda in the UK. And I know that you've now got your parliamentary duties and have to leave us because you've got an important committee to attend. So thank you very much. It's now my pleasure to give the floor to one of Germany's leading experts on infectious diseases and antimicrobial resistance, Dr. Andrew Ullmann. Dr. Ullmann, the floor is yours.
Yeah, thank you very much. And also thank you very much for inviting me here this morning. It is a very special day in Germany today. I do not have to leave right now, but within the next 2 hours, we're going to elect our new chancellor here in Germany, and we're going to have a totally new government, which I'll talk about a little bit later during my introductory remarks. I enjoyed very much the presentation from Laura Piddock, where she was addressing all those issues which goes very close to my heart, which always bothered me as a practicing physician in infectious diseases for almost 30 years. And I went into politics just 4 years ago. And I made it to my personal agenda to actually address this issue of the silent pandemic of multi-drug resistance. And what you mentioned, Laura, in your talk was a lot of focus on bacterial issues, bacterial infections. But of course, as we all know, we do have an issue about anti-infectives who develop a resistance to viral diseases, to fungi diseases, to parasitic diseases. And especially in the light of COVID-19, we are realizing or becoming aware of immune escape variants after being vaccinated against SARS-CoV-2. So there are a lot of issues coming up. And one issue is also very important, and you mentioned it as well, is the One Health, One Planet issue, that the use of anti-infectives in agriculture, in the world, is very important. And of course, we also have to realize that we live in microbiomes, that some bacteria are helpful and not all are dangerous. And this awareness, this understanding is really challenging to communicate to the other politicians as well, in my own party or in the parliament. And today we are going to have a new healthcare minister who is a physician. It's not me, it's somebody else. And this gives us hope that the understanding of the medical issues and the resistance issues becomes more aware. In our coalition contract that we made, because I'm part of this this group of the coalition, it's the three group, it's the Social Democrats, it's the Green Party and the Liberals, which I belong to. We also made very clear aware that we have to have a better pandemic preparedness, and which is not only focused on viral disease like SARS-CoV-2, it's also issue of multi-drug resistant. And Germany has a good history, which between all democratic parties, we do agree. We have the National Action Plan put in place in the year, I think 2015. It's quite a while ago and got renewed in 2020 for the national issues of multi-drug resistance, especially focusing on One Health. We also addressed the issue on in the G7 and G20 presidency where Germany placed multi-drug antimicrobial resistance as a top priority into international agenda. And during its presidency back in 2015, Germany addressed the topic of antimicrobial resistance, understanding that we need to work together in a multilateral direction, that all countries have to work together. And I think Laura Piddock placed it very clear how important this is. It is not an issue of a single country or a region. It is a global pandemic. And I'm very optimistic that next year, where Germany is going to take the presidency of the G7, and especially with the new health minister, I'm very optimistic that we're going to move this forward into a global issue, especially the plans of a global antimicrobial resistant R&D hub, which needs to be supported and put into place. The German global health strategy between now to the year 2030 is aimed to engage more intensively with international efforts to reduce the resistance and expand research into anti-infectives. Germany will work together to strengthen the global expertise and structures and support the efforts of a multi-stakeholder partnerships to combat antimicrobial resistance. Partner countries will be offered multilateral and bilateral support to develop and implement national action plans. And obviously, we have to reduce antimicrobial resistance in the developing countries because bacteria, viruses, even fungi do not understand the concept of borders. And this is a biological rule. And so we have to be very concrete in implementing a roadmap and a financial roadmap to get those goals into a new strategy. Antimicrobial resistance will never vanish from this world. It's going to be a competition between intelligence and the microbes. This is very clear, but I think if we work together very strongly, as we do see it now, which could be improved, of course, with the COVID-19 pandemic, there will be a lot of lessons learned from this pandemic to further combat antimicrobial resistance. And obviously, this is only possible in a One Health and One Planet approach. Thank you very much.
Dr. Ullmann, thank you very much. And indeed, the good news that your new health minister is a physician by training. And we know that antimicrobial resistance has really been a leitmotif of Germany's presidencies of the G20, previous G7 presidencies, and of course, when you take over from the UK next year. Thank you. And after Germany, it will be Japan. And so I'm delighted now to bring in Dr. Hajime Inoue, Assistant Minister for Global Health and Welfare, on how antimicrobial resistance is one of the world's pressing global health security issues. Dr. Hajime, the floor is yours.
Thank you very much for inviting me and convening this quite important meeting today. Today is also a special day in Japan. Today, tomorrow, the Japanese government is actually hosting the Tokyo Nutrition for Growth Summit 2021, where many leaders of the world are actually attending. And I think it's important to connect AMR with each and every global agenda. Nutrition is, of course, no exception, to ensure food production while minimizing the antibiotic use for each and every production is one of the agenda that we need to actually present to the Tokyo Nutrition for Growth Summit. And as such, I think it's our role to connect each and every global agenda. How important is it for us in our agenda on AMR? And this is also true for the ongoing COVID-19 pandemic. One of the most important lessons from the ongoing COVID-19 pandemic is that pathogen actually cross the national border easily. This is especially true for AMR as well, and reminds us the importance of collaborated response at the global level. AMR is one of the pressing global health security issue in the world, and in particular in our region, the ASEAN Pacific, where the challenge is overwhelming. It is estimated that nearly 5 million people die annually in Asia because of AMR by mid-century if proper action would not have taken. This is the largest number of the world in the world than in any other regions. To mitigate such a dire scenario, it's important to update national action plan on AMR in each countries. In Japan, regrettably, our ongoing current national action plan 2016 to 20 has not yet revised, mainly due to COVID-19 response. I've heard that many other countries suffers the similar situation. We should update our ongoing national action plan on AMR as soon as possible, and Japan will surely do so. In doing so, the value of the international collaboration and the necessity to elevate the issue of AMR control beyond just national agenda is a key to success. Japan would plan to extend our collaboration with low and middle income countries, especially in our region. Thank you, and over to you.
Thank you very, very much, Dr. Hajime Inoue. And indeed, the importance of updating national plans as well as thinking globally, because of course it goes beyond borders. I would now like to ask Dr. Renu Swarup to come into this conversation. Dr. Swarup is the former secretary to the government of India's Ministry of Science and Technology. And Dr. Swarup, if you could give us the perspective of India, a country which is the world's largest pharmaceutical industry, I believe. The floor is yours.
Thank you very much, Claire, and thank you so much for having me for this very important session on AMR. First of all, I think the presentation which was made has really outlined very beautifully the importance of the subject and how all of us need to look at this as a priority moving forward. And I think COVID has clearly brought the spotlight on the science and technology solutions to fight certain priorities such as this, and very aptly said, this is the silent pandemic. We don't really need to wait for another pandemic to let us know how important it is to have S&T tools, which will then be able to move ahead. And clearly, that's really where the investments in science and technology come forward. The clear action that needs to be taken on AMR, and as you have said, my involvement with the action plans for the AMR were in my position as the secretary in the Government of India, where we've had within the Government of India a very well articulated, very well framed national action plan in which there is a whole vertical on R&D and innovation that also then allows us to see that there is a focus on R&D and innovation. But what is it that we need to do now if we have to move forward? As has been said, a large number of countries have the national action plans, but are these action plans actually being implemented? Is there a proper, worked out monitoring system for these action plans? There's one point in having an action plan, but the actual sense is in having them implemented to make sure that they meet the needs of the countries in trying to see how we move ahead. Within India, as you know, health, you rightly said, a large country. We've got a federal structure. We've got health as a state subject to be implemented right up to the last mile, where we have a very well-structured system in place for our health. And now COVID has also brought in the spotlight on the health infrastructure. With this, it helps us to then take AMR also through those channels, through that well-developed system that we have for health. What is it that we need to focus on? Is it only looking at new antibiotics or anti-infectives? As has been said by the speakers before me, it's very important to have a very well worked out surveillance mechanism. And I think that's really what we need to look at. We also need to have, as has come out during the COVID times, emphasis on the diagnostics, on trying to develop a very good testing system, treatment protocols. So far, we've got, again, suited to different needs, etc. But what we've done for COVID is exceptional. We've had everything well documented, and that's really what has made it possible in a country as large as India to make sure that whatever protocol, whatever action is taken or in a coordinated manner reaches the last mile. So we do need to have these various interventions which are developed through science and technology taken and translated to the last mile. This clearly again takes us to what I just said. We need to invest in R&D, and we also need to know that R&D for antimicrobial resistance is a high-risk investment. So the appetite for high-risk investments, and that's what the Government of India has actually done through the Ministry of Science and Technology. There has been focused investment on R&D for AMR. But what also came out very clearly within the COVID is that it cannot just be countries working in isolation. It's the global collaboration which matters most. We need to collaborate nationally, of course, because with like a country like India, we've actually had collaborations within the Science Ministry to make sure that you have new S&T interventions, collaborating with the Health Ministry to make sure that the S&T interventions which come from our laboratories actually meet the need of the health interventions or the health care systems, but also importantly to see that they are through the delivery mechanisms in a mechanism that we can take them down there. So, but national collaborations, but global collaborations. Global collaborations are very important because you do need to have effective knowledge and databases which can then be shared amongst countries to add to what we've seen happening in the COVID. Also, what has come out very clearly for the AMR, it's a One Health approach. And rightly said by my colleague speakers, it's the transboundary movements that we need to be very careful about. When you look at the transboundary movements, it cannot be just national surveillance. You need to have global surveillance networks, because you are talking about microbes, which very rightly said do not have borders. You cannot really hold a microbe. Right now, all our focus is on COVID. We are looking at international travels. We're looking at testings for the SARS-CoV-2. This cannot be done for a long term. You need to have well-developed global surveillance networks and databases. And I think the learnings from COVID, as a country like India, we definitely are taking that forward, but globally also this has to be taken out. What did we do in COVID times? This came as a pandemic, as a surprise to all of us. But very quickly, in a couple of months, we developed multiple solutions for interventions for COVID, whether it was diagnostics, whether it was the treatments, or whether it was the vaccine for prevention. Never before have we ever heard of a vaccine being delivered in less than 12 months. We all did it. And how was this? It was because we focused on the research. We looked at the innovation, the translation, the product development. These were all highest up in everyone's national and global agenda. In these last nearly 2 years, we've only spoken about how we could invest in research, translation, commercialization. But what was it? What is the key success? It was clearly this collaboration, this convergence of ideas, convergence of thoughts, and most importantly, a commitment all of us made that we need to fight this pandemic. I think this commitment needs to go beyond for all other such major things like AMR. Another important point that we looked at is, how did we do it so quickly? I think the way we did it so quickly, and if you look at it being a scientist, I can say from our science ministry, we built on existing knowledge. We built on existing platforms. It's not that we reinvented or we looked at new things. We looked at the knowledge that was there. We looked at the protocols which were there, the SOPs, and we quickly built upon them to come up with newer ones that we can move ahead. And this really is the India experience that I was talking about. We focused on indigenization. Why is indigenization important? Because countries need to be self-reliant as well. There were global disruptions, supply chain disruptions when the pandemic hit us. And because of that, it's now important that we build these capacities. We build these capacities regionally, we build these capacities nationally, and most importantly, in the LMICs as well, because that's when you're going to ensure equitable access if you have capacities all over. So you're going to talk about creating consortia, not just for delivery, but for research as well. And one thing that came up very clearly for us was the strong industry-academia partnership. These PPP models worked because the research came from the academia, quickly translated. We looked at shared infrastructure that we created within the country. I mean, India is very proud of the fact that we have a basket of vaccines that we could develop indigenously, all different platforms, but we made available our shared infrastructure. And most importantly, we created enabling policies to help that. We created biorepositories for it. Now, I think for AMR, we've already put in a lot of investment within the government of India. We put in investment for research networks. We put in investments for helping startups. We've put in investments for collaborating with global consortia. We are partners in the Global AMR Hub. We partnered with the Longitude Prize and many other such partnerships that we have. And of course, our partnerships with GARDP and the NDI, they're all very, very vibrant partnerships. But I think it's important. We've created a priority pathogen list with the WHO. We've created a dedicated AMR repository. But now is the point is, how do we prioritize our research to move ahead? What is it that we need to do? So I think in conclusion, I would just like to say the learnings from India have clearly brought to us two clear recommendations. And that is, if we invest in R&D, we prioritize our action, we create these global coordinated networks, and most importantly, build the required human resource and infrastructure capacities across the world to make sure that there is not just equitable access, but there is also enough capacities to be able to do these productions and co-developments across the world, so that, rightly said, it's a one planet with a one global challenge, which we can all address collectively. So thank you very much, Claire, for this.
Thank you, Dr. Swarup, for outlining some of the initiatives that India has done to address and accelerate your response to antimicrobial resistance. I'm now going to ask our experts a couple of questions, and I can see that the audience, thank you very much, lots of questions coming in, and we're going to make sure that there's time for our speakers to address those questions. Dr. Ullmann, you were outlining some of the issues in your opening remarks. I'm just wondering whether there's something particular about the challenges posed by antimicrobial resistance that really make a coordinated multi-sector action so essential.
I think one of the challenges is to develop a global infrastructure to understand the development of antimicrobial resistance, since a lot of epidemic changes are hard to predict and sometimes more challenging to avoid. And it is something, on top of it, something very natural that antimicrobial resistance develop, especially the challenge with antimicrobials in animals, in food, in plants, in the environment, and then it could easily spread from person to person between the people and animals and food and animals, etc. So there are a lot of intertwining issues that come together. But also we have to understand that hygiene plays also a very important role. We're focusing on drug development, but we also have to focus on hygiene issues or sanitary issues, especially in humans, but also in animals, which is important. If we don't have a working concept for sanitation and hygiene, all the efforts with new medicines, vaccines, diagnostics are useless, and that actually sets the line for the importance of cooperation internationally together. It's also important that medicine and veterinarian medicine work together, together with agriculture, also on an international level. So there are a lot of issues that have to be addressed, have to be strengthened, has to be done, and especially the hub for epidemic and pandemic intelligence, the WHO, has to further work on this on these issues. Otherwise, I will leave it at this point, and I would go into the next discussions in the next round. I think that is enough for right now. Thank you.
Thank you, Dr. Ullmann. Yes, indeed, the importance of the One Health approach. Dr. Inoue, you mentioned in your opening remarks that these national plans are behind schedule. If we look in the short term, what do you think the priorities for addressing AMR should be?
Well, as health ministry officials, now our main attention, not only Japanese health ministry, but all the global health community, is how to reconstruct our global architecture on prevention, preparedness to the health security that we are currently suffering from COVID-19. And Ebola may come back at any time, or SARS, MERS. We experienced several the outbreaks in the past. The next one, I don't know what will be the next one, may come at any time. And now the global community is discussing on how to better prepare and how to better respond to the next health threats. And I'm a bit worried that in these ongoing discussions, AMR is somewhat forgotten. People talking about COVID-19 and Ebola, Zika, SARS, MERS, of course, pandemic influenza, but not that much on AMR. So that discussion on AMR is somewhat disconnected from the global debate on how better we restructure our system itself. And I think it's important for us to try to connect the ongoing discussion with the issue of AMR. AMR is certainly global threat. AMR is certainly one of the biggest health security issues. So if we miss this hot opportunity, hot time of better prepare and create a new system, I think the opportunity would be lost. And in this short term, I think it's important for us, the AMR community, to try to connect the AMR with the ongoing global discussion on how to better respond to the next global threat. Thank you.
Dr. Inoue, indeed, that there is a short window of opportunity to raise this, and I can see that a lot of the questions from the audience are all about seizing this opportunity. So I'll go to the audience in a moment, but first let me go to Professor Laura Piddock. Obviously, GARDP is a private-public partnership. We've heard that these are really one of the solutions to tackle AMR. Can you tell us why you think that this is such a good solution, given the gravity of antimicrobial resistance worldwide?
Yes, thank you. So GARDP is a non-profit organisation, and our role is to focus on gaps that others may not fill, but to do that by linking the different actors in the antimicrobial ecosystem, if you were, all the way from discovery right the way through to post-approval, access, manufacturing, etc. But we want to fill gaps that perhaps aren't commercially so attractive to for-profit industry. So as I've mentioned, babies and children in particular, but also underserved populations such as those that suffer from gonorrhea. And while gonorrhea is not going to kill an individual, it certainly seriously hampers lifestyle. And if I go back to penicillin, it may surprise some to know that penicillin was first developed during World War II to treat gonorrhea in frontline soldiers so that it could get back on the fight, as it were, on the front line, because it gave them such morbidity. Of course, we now know that penicillin, it was considered a wonder drug, and in many ways still is. So, you know, gonorrhea is still an important infection to treat, particularly drug-resistant gonorrhea. And an additional point about gonorrhea, of course, is the impact it has on women and their fertility, and therefore their ability to look after children, and the whole impact again on younger generations. But the reason a partnership works well is it allows the strengths of each partner to be used to their best. So it also will de-risk some of the issues that particularly small companies have, and it may also allow some drugs to carry on through to clinical development that otherwise would not, or would get to approval, and then, as we've seen with some small companies, where they've then had to cease trading due to lack of investment, will allow those drugs to go on and reach the patients that need them. And then the last thing is, by being a partnership, including different actors, we've been able to start establishing new networks in countries where drug resistance it has the greatest burden. So we're establishing clinical trial networks, and we're investigating sites in a variety of countries, in addition to the ones we've already got up and running for our gonorrhea drug, zoliflodacin, but in particular, establishing clinical trial networks in South Africa and also India.
Professor Piddock, thank you. And I think in your presentation, you also mentioned these phase 3 clinical trial tests for gonorrhea. Perhaps a very quick update on the time frame and a little bit more detail on that, because this is a good example, as you say, of a public-private partnership.
Yes, so our trial sites are in the US, the Netherlands, South Africa and Thailand, and they're continuing to recruit patients, as I said, despite the impact of COVID. And every month we're able to recruit more patients, which is really good considering our current concerns over the Omicron variant of COVID. So we're about 200 patients in, and this trial will continue next year as well until we get the right number of patients treated to be able to what we call unblind the study and see the impact of this new drug versus the standard of care which it's compared with.
Thank you. Dr. Swarup, at the end of your remarks, you gave us some learnings from India about investment in R&D and prioritizing various actions. I'm just wondering, what lessons do you think the rest of the world can learn from the Indian experience and some of your solutions?
Thank you, Claire. So for the experiences that we have, while we've done a lot in terms of drug development and our work which is going on clinical trials, I would definitely like to refer to our recent investments in COVID, because as has been said and very rightly said, we should use this challenge that we have as an opportunity to be able to then put the spotlight on AMR and other such important diseases if we could do it for COVID. And what we could achieve in this is, I think, first and foremost, our major learning was that if we had to do this in a countrywide manner at this point, getting all stakeholders on board, whether it was the policymakers, whether it was those who were to give us the investments, was to make this into a citizen-driven campaign. It was a citizen-driven, and it is even now a citizen-centric approach that we are following, making sure that whatever we come out as our tools, as our scientific tools, is basically to help. And that's where awareness is so important. The awareness, creating the awareness of what problems the COVID and the challenges that COVID brings to the citizens. I think, first of all, we really need to bring the same level of awareness for AMR, because once it becomes a citizen-centric approach, it's much easier for us then to take it through, whether it is for any of the R&D investments or for any of the clinical trials, because clinical trials, again, pose a lot of challenge in terms of, recruiting and others. So if it becomes a citizen-driven, everyone knows that it's really going to be one intervention for them. The other major learning that we had, and as I said, is that I think we've been talking about PPP models, we've been talking about industry-academia interface, and also blurring the boundaries between them. I think that came up very well in COVID times. And if we can now just take the same to AMR and keep reiterating the fact that this is a silent pandemic that may hit us, because there is clearly a continuous basic knowledge generation that has to keep coming. And that basic knowledge generation is what then goes through the translational phase to product development. So the continuous prioritization is important, and that's something that we've done. And thirdly and lastly, which was most important from us, was what I just said, creating not just an investment for a product, but putting in investments for the ecosystem. And I think what we've done in COVID is we've created an ecosystem. We have set up right from the shared infrastructure, which allows many academic and small industries to sort of access that shared resources, animal challenge facilities, immunoassay laboratories, biorepositories, which actually help samples to be distributed, and clinical trial sites. For COVID, we have 54 clinical trial sites that we've set up across the country. That's what's allowed us to take this forward in such a large manner. So I think this is really a learning that we would like to take forward beyond COVID as well, focusing clearly on two things: the citizen-centric model and the PPP model. Thank you.
Thank you very, very much. Well, as you would expect with an audience made up of parliamentarians, we've got lots of questions coming in. So I'd like to say to our speakers, I'm going to direct one of the questions to one of you. If anybody else would like to come in on that question, please either in the old-fashioned way, just raise your hand or use the hand icon. And Dr. Ullmann, I'm going to start with you because I know you mentioned animal farming and that relationship. So there's a question here. In terms of the connection between medical research and animal farming, are we doing enough Today, I just saw an advertisement in a supermarket saying that this meat is free of antibiotics. Is this the right path? So 2 questions there, Dr. Ullmann.
Well, I think the first question, we could never have enough research. I think that is a very simple answer. And there is more to this just with advertisement saying that meat is without, or that the animal grew up without antibiotics. It is not always the case, or very seldomly the case, and it's a good idea to focus that the meat has no antibiotics. The idea behind it is basically that the meat is still clean of any multi-drug-resistant bacteria. That's the thought behind it, but it's not always the case. We all do know that, and therefore it is important that we actually increase our efforts with beyond those sectoral thinking of animal farming and human research. I think that has to come together, and there's still, in my opinion, a lot more to do.
Thank you. Another question, hospital environments are more likely to develop multi-resistant infections. Do you think that trying to think about new strategies of decreasing hospitalization time could help? Dr. Inoue, I don't know if this is a question for you, but I put you in the hot seat on that one about the need to decrease hospitalization time, because we know that they can be breeding grounds for these multi-resistant infections. And if you'd like to unmute yourself.
Yes, thank you very much. This is a quite interesting question. Generally speaking, each and every country are actually trying to shorten the length of stay, not from the standpoint of AMR, but more on economic point of view. And in Japan, we are actually offering incentives to hospitals where they could reasonably minimize the length of stay while maintaining the quality of care in our payment system to each hospitals. And because of that, in the past few decades, the length of stay, average length of stay at the hospital has been substantially decreasing for the same health conditions, for the same treatment. And I have never think about its effect on MR, but I think it's true that while minimizing the length of stay at the hospital, this also contributes to the risk of contracting MR. This is a quite interesting point that I haven't been thought of before, but let me think about this issue from now. Thank you very much.
Thank you for that great question. And I see that Dr. Ullmann, who of course was a physician by training, is also interested in answering this.
Well, first of all, there is a clear correlation between hospital length of stay and acquisition of multi-drug resistant bacteria. That is obvious. There are a lot of papers out there that actually prove the fact, but also on top of that, the misuse of antibiotics in the hospital, a longer duration of antibacterial treatment causes more multi-drug resistant. This is clear. And however, and I think I totally agree with my Japanese colleague here that hospital length of stay have to be shortened, not from the economical point of view, that is also very helpful, but from the point of view of the patient. And we do see serious differences even in our country, in Germany, which the hospital length of stay is shortened, but it's still long, very long compared to international data. And what we have to do a rethinking in the inpatient care, that a lot of patients need outpatient care, which could be done. We do not need that much inpatient care. And this is a rethinking in the hospital scene internationally. This is not only an issue in Germany, but I do know, because I practiced medicine also in a couple of years back in the United States. It's the same issue there. We have to be more efficient, but we also have to be clear that we need more outpatient care instead of inpatient care.
Thank you very, very much. Professor Piddock, a question for you. Are we able to have a clear channel to aggregate data from different countries to create a profile of resistances of specific antibiotics? Are there major differences between them?
So I'll start by answering the last part of the question. Are there major differences between different antibiotics and the amount of drug resistance? And yes, there are. There are differences between countries, between regions of the world, and for each antibiotic type, so drug class as we would call it. There are various repositories for global data. So the CDEP website has something called Resistance Map, where you can see lots of information. The Financial Times also has an antibiotic resistance section, and you can access lots of this data. And then the World Health Organization has their global antimicrobial resistance and use surveillance system, and you can see their data as well. So there are various sources of data, and you know, one of the interesting factors about it is, yes, in certain countries there's very high levels of resistance, but for some drugs, even though they have high levels for many drugs, there can be very low levels to others, and this sometimes can reflect availability of the drug. If that drug is not used in that country, unless that type of resistance is taken in by an individual or individuals, then that resistance is not going to be seen that greatly. Just coming back to the last point about hospital-acquired infections, I think we need to remember that people take those drug-resistant microorganisms into the hospital. So they are originating in us, and we take them around and we share them with people. And in hospitals, sometimes the procedures allow that can happen, and it's very difficult to minimize, and particularly with some fungal infections. I know we've been talking about bacteria in the main today, but fungal infections, if that gets into a particular unit, sometimes the only option is to close that unit down and do what we call a deep clean. So there are other ways of dealing with resistance, but I think first and foremost, there are sources that we can look up for any particular resistance for our own local area, should we want to do so.
Professor Piddock, another question for you. Of course, everybody was amazed, I think even the pharmaceutical companies themselves, by the fact that we've got these vaccines for COVID so quickly. So is there a role for vaccines in tackling antimicrobial resistance?
So yes, there are for certain infections, and we've seen this very well demonstrated with the pneumococcal vaccine, which has been used in many countries and has led to a big reduction in infections by Streptococcus pneumoniae, which is the bacterium, including penicillin-resistant Streptococcus pneumoniae, which was a concern. We have to remember, though, that vaccines are not the solution to all problem infections, including drug-resistant infections. So, for instance, some bacteria either live on our skin or in our gut. They're part of what we call our microbiome, and they're there for a reason to keep us healthy. Without them, we wouldn't be particularly well. So we would not want to vaccinate against some of those microorganisms, even though they can go on and cause very serious infections in the bloodstream and lead to sepsis. So we're always going to need treatments alongside vaccines.
Well, I've heard that one also with the COVID. Treatments and vaccines are complementarily. Dr. Inoue, a question here. The Global Action Plan was released in 2015. Do you think it still reflects the needs that we have, and should it be updated? And if I could ask you to unmute yourself.
Thank you. Well, Global Action Plan was adopted at the World Health Assembly at WHO in 2015, followed by the similar adoption at the FAO as well. So this is adopted by both sides, human health side and also animal health side. And it have the 5 pillars in my understanding. One is, simply put it, awareness. The second is actually surveillance, getting quite data. Third is minimize the infection by hygiene, vaccines, and so on. The fourth is research and development. Fifth is stewardship and appropriate use. And I think these 5 key principles still works for today. And I myself do not feel any need for additions to the element 6 or element 7. If there are certain missing points, I think that would be an element on international cooperation, collaborations. I mean, global action plan becomes the basis to be making a national action plan, each and every country, and actually 130 to 50 countries, majority of the countries actually made their national action plan, followed by the 2015 global action plan. And mostly each national action plan follows these 5 elements. And if we are to add one more element, I think that's an importance of the collaboration, global cooperation, not only a single country to do, but multiple country or a global community to do. Thank you.
Thank you. Dr. Swarup, the question here is, do you think policymakers are aware of the real dimension of this problem, even the ones who are working in the health sector? As it is a silent pandemic, the questioner says, I'm not sure if it's something that really will be spotlighted. And in fact, Dr. Inoue also mentioned this, that he's a little worried that this is not seen as a priority, particularly outside the health sector. Your thoughts on this, Dr. Swarup?
So I think policymakers are aware, and I'll put the India example before you, and that's the reason why we have an action plan which is well coordinated, which has been implemented. But yes, I think considering the spotlight that has gone on COVID recently, there is definitely a need to raise the level of priority that AMR has currently. And I think that is right now the opportunity for us to do that, considering that, as Dr. Inoue very correctly said, the global action plans already have listed out the key principles. And the same key principles, if you look at COVID, have been actually so applicable to our management of COVID. So if we can do it in that focused manner, so what is it that we need to do differently is probably then somebody would ask that if the priority is there, you have an action plan, what is it we need to do differently? I think what we need to do differently now is considering that AMR is there, the spotlight is on K, we need to bring it there. We need to prioritize our actions on it, whether it is in terms of looking at the surveillance, and as I said, creating a coordinated approach for it. And this would not be just at the national level. I think we need a global platform to bring this more into the forefront. Also considering the fact that we now know how effective it is to invest in R&D and get immediate solutions for it. So I think that is again a priority that we need to do. So identify the priority and then in a focused, time-bound manner, create an action plan which you know how you are going to, either you're going to create the infrastructure for it or the human resource for it, or any of the global actions that we need to take around it. So I think that's really what we need to do.
Mm-hmm. Thank you very much. Dr. Ullmann, a question for you, again with your physician's hat on. The questioner says, many doctors, when they prescribe an antibiotic and it doesn't work, don't tell the patients or explain that they're changing the therapeutics because of AMR. How can we communicate AMR to society in general? And I'm sure perhaps everybody would like to have a go at this one, but I'll start with Dr. Ullmann.
Well, I think first of all, it is very important to have a good patient-physician relationship and to really be sure that the patient is the partner and not a child that has to listen to the physician and do what has to be done. My experience over the years as a physician was very clear-cut. The better I explain, the better understanding the patient has, the better compliance is to be expected. With taking his medicines or not taking his medicines, obviously. I think this has to be taught early on, starting in medical school, that communication skills are essential in patient care, and not only to know which MRI is necessary or which medications have to be given, that the skills of talking and exchanging communication with the patient, I think that is essential, and everything else will fall into place easier. In my practice, I was always outspoken with multi-drug resistant bacteria. I even had an outbreak in our hospital over 15 years ago. I even went public with that so that everybody really knew we were very transparent with those issues, and there was a lot of understanding in the community.
And in fact, this picks up on another audience question, which says, who is a healthcare professional? And they say, I think that one of the most important things is for my colleagues to understand that this is a major problem and that they have an important role to play with the people they care for. What is the strategy to reach out to them and to let them know the updates of AMRs? So the tenant of that question seems to be that perhaps doctors are not always informed with the latest developments. Dr. Ullmann, your thoughts?
Well, that is also an additional issue which we actually now addressed in Germany, and thanks to COVID-19 lessons learned, we now have specialty infectious diseases. We didn't have this in Germany. We only had a specialty until just recently. And I think this, not the communication, but the skills and the training of infectious disease specialists are going to increase now, at least for my country. And I'm very optimistic that then the knowledge and again, transparent communication is essential to this issue. And if this is not done, we will lose the trust of patients. We will lose the trust as physicians and researchers. And only together we can tackle these issues. And as with COVID-19, where a lot of people say we do not believe that there's a virus, we do not think the vaccines work. These are the same issues everywhere. Transparency and good communications are essential. It sounds a lot easier than it really is, but if you go out to the public, get it explained, scientific journalisms, all these points have to be addressed adequately so that we do not have this field of people who deny any kind of research or science.
Dr. Swarup, your thoughts?
I just wanted to take forward the point that has been raised about communication. And I think this brings to the point that I was saying, that we need to make it a citizen-centric approach. Communication has played such an important role in our management of COVID. And especially in a country like India today, when we've had more than 1 billion vaccinations done, to a country where we have, even in some places where the literacy rates have been low, everybody is understood. The vaccine hesitancy we've removed in a big way, because we could convey to them the importance of vaccines to help save their lives. I think this is the communication strategy that is required to be able to convey to every individual how important it is for them to have a prevention and a treatment for AMR. Many a times there is non-compliance of treatment. You start the treatment regime and then there is a non-compliance, which takes you back to where it was. So I think conveying appropriately, and even in the question that was asked, I think it's not just the updates for the doctor, it's the updates for the citizen as well. And I must say here, in our COVID management, the media has also played a very important role. It's not just scientists as journalists or scientific journalism, it's media who's really been able to play a very major role. And I think we need to continue to focus on this if we have to prioritize and put the spotlight on maybe issues like AMR.
Professor Piddock, I can see you nodding your head there. And I remember I moderated an event for GARDP where there was a doctor from South Africa who said the problem with the communication is that, as you say, there's no face of AMR. There's a face of the pandemic, but not of AMR. Professor Piddock, any thoughts on how this is communicated better to general society? And then I'll come to Dr. Inoue.
Thank you. Well, I've done quite a lot of media work over the years, from going from sort of programs like BBC Horizon right the way through to science shows or book festivals. And we have to get our messages very clear, and we have to agree as a community what our messages are, and use words that the people we're talking to understand. Actually, that has been a problem with COVID in certain countries, that the experts are using language that's not well understood. On the other hand, for us now, you know, the general public understand mutation, whereas 2 years ago they didn't. And we can really benefit again from what, that really there's been scientific education of many populations, and we can benefit from this. I do think there's a need to keep getting our messages out. And you know, it is a disappointment to me that, as mentioned earlier, that AMR has somewhat slipped off the agenda. And I don't mean just in policymakers, because everyone's been so focused on COVID. I mean on the media as well. And, you know, we do have to bear in mind, when the next pandemic comes, as we all know it will, and it could be influenza, antibiotics will be absolutely essential. So we have to understand that not only are they needed for our everyday medicine now, and in some parts of the world, they don't work very well, or we haven't got access, they're going to be needed for the future. So we have to get those messages out, and we have to engage with our young people, because those are the people who will really change society going forward. And I do believe our media should be doing much more with young people, as well as healthcare professionals too.
Dr. Inoue, perhaps the Japanese perspective on how do we communicate better to broader society, particularly, as Professor Piddock says, young people?
Well, in each and every major diseases, there are certain patient groups or certain phase, celebrity who suffer from disease X, Y, Z, are strongly advocating to treat or research on those diseases. Let's say TB, malaria, HIV, cancer, not only cancer, lung cancer for this group, or stomach cancer for this group, and so on. We actually do not have such a strong advocates on AMR. This is one of the issues why AMR is less popular, less well-known among public. In Japan, of course, everybody knows the name TB, malaria, HIV, cancer, but not many people know even the word AMR. The word itself is still not yet well-known. To break this situation, I think we need to actually foster our public relation more strategic manner. There are certain survivors from multi-drug resistance infections, including celebrities. Perhaps we could pick up or encourage these survivors to form a patient group or survivors group, or ask celebrities who suffered from multi-drug resistant infections to work on AMR for the people or for the public to know there is a certain problem on AMR, which is comparable to the disease burden of other major diseases. We actually need a certain faces and patient group on AMR, as we've been doing for many other major diseases. Thank you.
Thank you. Professor Piddock, an audience question. Predictions say that the 700,000 or more deaths that antimicrobial resistance now cause every day could grow to 10 million by 2050. I think that was mentioned in the video. It's been mentioned by other people. It could cause 10 million deaths per year by 2050. The audience member is asking, is this an accurate way of thinking?
So those figures arose from the AMR review led by Jim O'Neill and were based on published data for only a few infections, and in particular caused by E. coli or MRSA. So many people consider these to be underestimates, but we don't collect data in the way we do for COVID. So there's no national dashboard for how many cases of drug-resistant infections, how many hospitalizations, how many deaths. And although the World Health Organization GLASS scheme is now collecting mortality data, this is very much focused again on a few infections, not all infections. So my personal opinion is 700,000 is an underestimate, but I couldn't even begin to guess what the figure really is. And I don't know if Dr. Ullmann would have a better idea than me. I think it's being suggested that at least 23,000 people a year would die in the EU or a similar number in the US, but I think these numbers are always estimates.
I would like to give the floor to Dr. Ullmann, perhaps to answer that, but also perhaps the final question from the audience, as you also are an MP. What role can parliamentarians play to combat antimicrobial resistance? Dr. Ullmann.
Okay, first of all, to the first question, I think there are just modelings. They are not just, but it is scary to look at those numbers, but these are estimates. These are clearly estimates, and they're right. The ranges are very wide. However, they are still huge. So I think those numbers are very clear. To the second question, what can a single MP do? Not much. The single MP has to really work together with colleagues, not only in his or her own party, but our fraction, but also with other colleagues together. And at least I could say here in Germany that despite the fact that we have a clear differentiation between governmental coalition and the opposition, we work over those boundaries together. The coalition discussions for healthcare was hard because we had the same aims, but how to get there was a little bit harder. But the importance is that, at least that is my impression, a lot of MPs in health politics are considered nerds because it's so complex, so complicated, so many things to consider. But it is the challenge to make it simple, to make it aware to the other colleagues, and also to make clear the understanding of the threat that we have. I do remember when I was talking to my party leader about the threat of the upcoming coronavirus back in January of 2020, before it really started off, when we had the first issues from China and North Italy. I said, there's something big coming to us, and it is scary. And I personally never expected that it was so true, this whole COVID-19 story. But that said, it is communication and working together as a politician, what we do every day, but making the awareness and understanding very clear if you are in the healthcare politics to make it easier, understandable for the others.
Thank you very, very much. And on that note, I would very, very much like to thank our speakers, Dr. Swarup, Dr. Inoue, Dr. Ullmann, Professor Piddock. Thank you, audience, for those really great questions. And to conclude, I'd like to hand back to our MC, Eloise Todd.
Thank you very much, Claire. What a fantastic session to kick us off today on our day 2 of the UNITE Summit. I just want to say that in that session, we had everything from the strategic issues and challenges facing us at the global level, right down to what needs to be done at the policy level nationally. And I thought it was great how that conversation moved towards the end to why are we not getting more attention on AMR? What needs to be done? And really, it comes down to that communication that was spoken about towards the end and that political will. And that's a nice segue to our next session, which will be on building political will on neglected tropical diseases. So if I can thank everybody on the panel for a fantastic, stimulating first discussion, and close this session and ask you to return to your screens in 15 minutes time. That's 10:45 GMT or 11:45 Central European time for our next fantastic session. Thanks so much, everyone. See you in 15.